I'm Dayant, and today I'll be talking about the strategical analysis of RCC Surgical Hospital PLC. The title of my session is Choose the Surgical Specialist, and really that title say a lot about how the hospital wants to be seen in the healthcare market. Because when people choose a hospital, they are not just choosing a place for treatment, they are choosing a trust. They are choosing a expertise. They are choosing confidence that the care they receive will be safe, modern, and effective. That is where RC Surgical has positioned itself. In this presentation, I'll take you through how the hospital builds its strategy, how it responds to the challenges, and why it continue to stand out in advanced surgical care. Let's begin with the hospital strategic direction because every strong organization needs a clear sense of purpose. RC Surgical's vision is to become a leading healthcare provider in South Asia, known for the highest standard of clinical excellence. That is a strong ambition, and it shows the hospital is thinking beyond the local market. Its mission is to improve the quality of human life through ethical healthcare and advanced technology. So from the start, the hospital is telling us that it wants to do two things well: deliver care responsibly and use innovation wisely. This is often shown as a house of quality. At the base are the hospital core values: care, society, innovation, and respect. These values support the mission, and the mission supports the vision. So the strategy is not a random. It is built a very clear, connected way. Now, let's step outside the hospital and look at the bigger environment around. A useful way to do this is through PESTEL, which looks at political, economic, socio-culture, technological, environmental, and legal factors. For us surgical, the most important one are really the social, cultural, and technological factors. From a political side, the hospital benefit from BOI tax exemption, which helps profitability. But it also faces higher cost because of VAT on medical equipment. So there is always some pressure on expenses. Economically, the environment is fairly supportive, and the moment with moderate inflation and easing interest rates, still there are challenges like high energy cost and the migration of skilled healthcare professionals abroad. The socio-cultural side is especially important. Sri Lanka has an aging population, and at the same time, non-communicable diseases like heart diseases and cancers are becoming more common. That means the demand for specialized surgery is like to keep rising. And that is exactly the kind of care RC Surgical is built for. Technology is another big strength. The hospital has invested in AI, robotics, and advanced imaging, including the country's first AI integrated cardiac cath lab. So, technology is not just something extra here, it's part of hospital's identity. There are also environment and legal factors. The hospital focus on waste management and energy efficiency while maintaining compliance through strong quality standards such as ACHS and JCI accreditation. So, overall, the external environment is challenging, but it's create clear opportunity for specialist hospital like RC Surgicals. If we now look at the industry itself, competition is definitely strong. Using Porter's five forces, we can see that competitive rivalry is higher among private hospitals. Several institutions are competing for patients, specialist consultant, and reputation. So the market is crowded, and hospitals need more than basic services to succeed. RC Surgical has managed to create a strong position in the space. The threat of new entrants is fairly low to moderate, mostly because building a specialist hospital requires huge capital, advanced systems, and clinical credibility. That is not easy for a new player to do so. The bargaining power of supplier, especially medical professionals, is also important. Skilled doctors and healthcare workers are in demand. So they have options. But RC Surgical reduces that pressure by being known a respected employer with a strong facilities and opportunity for advanced practice. So even though the industry is competitive, RC Surgical has built a position that gives it strength and resilience. Now, let's look inside the hospital itself. RC Surgical has both tangible and intangible resources. On the tangible side, it has more than 150 beds, specialized theaters, and strong clinical infrastructure. There are the viable assets that support service deliveries. But the intangible side is just as important, maybe even more important. The RCT Surgical brand is highly recognized, and the hospital is known for clinical leadership in procedures such as transcatheter aortic valve implantation TAVI. That kind of a reputation take years to build, and it is very hard for competitor to copy. If we apply the VRIN framework, these resources are clearly valuable, rare, and difficult to imitate. That means they create a real competitive advantage. So the hospital is not only strong because of its equipment, it is strong because of combination of expertise, trust, and brand identity has built over time. A SWOT analysis helps us to put the picture together more clearly. The hospital's biggest strength is its leadership in complex and advanced surgeries. That is where it truly stands out. One weakness is that profitability was somewhat moderate in 2025 because of lower finance income. That does not change the overall strategy, but it's somewhat that management needs to keep an eye on. One major opportunity is the chance to expand into area like liver transplants and most personalized care. These can deepen the hospital's specialist position and open new growth possibilities. The main threat is the continued migration of healthcare talents. If skilled professionals keep leaving, that can create long-term pressure on operations. So the short picture is fairly balanced. Strong position, good opportunities, but real talent risk that need active management. RC Surgical follows a broad differentiation strategy. In simple terms, it does not try to be the cheapest hospital. Instead, it tries to be the most specialized, advanced, and trusted. Its value proposition, precision, and heart explain this very well. Precision stands for technical quality, accuracy, and clinical excellence. Heart stands for empathy, care, and the human side of healing. That combination is very powerful in healthcare. Patients who need major surgeries are not just looking for procedure. They are looking for a confidence, reassurance, and a provider they can trust. So, by combining modern technology with compassionate service, Asir Surgical create a value proposition that is hard for revivals to match. The hospital has also expanded its scope in a smart way. Recent moves like the launch of neuro and spine clinics and the growth of kidney transplant programs show that Asir Surgical is continuing to strengthen its specialist identity. These are not random expansions. They fit the hospital's overall direction and reinforce its role as a surgical specialist. Its partnerships with the Ministry of Health and the BOI also help extend its strategic reach. So the hospital is not just growing its size, it is growing in importance within the wider healthcare systems. Of course, a strategy is only useful if it is executed well. And this is one area where Asri Surgical seems to be doing a strong job. The hospital has embraced digitalization to improve the patient journey. For example, many OPD patients now wait less than 15 minutes, which is a very good sign of service efficiency. It also uses the Emojot AI platform to collect real-time feedback, so issues can be identified quickly. And the discharge workflow monitoring system helps make the patient flow smoother and more organized. On the people side, the hospital promotes a zero harm horizon culture and invests heavily in training. More than 1,500 training hours shows that staff development and patient safety are not treated as side issues. They are part of the strategy. So when we talk about execution, RC Surgical appears to be quite disciplined and performance oriented. The financial results also tells a positive story. In the 2024-2025 financial year, revenue grew by 8.5% to rupees 7.1 billion. That is a strong result in a tough healthcare environment. Then in the March 2026 interim statement, revenue increased further to rupees 7.7 billion and profit reached to rupees 976 million. These numbers matters because they show the strategy is working not just clinically but financially too. They also suggest that the hospital is balancing growth with cost pressure in a fairly effective way. So the financial performance supports the idea that specialization and differentiation are paying off. So to wrap up, Asri Surgical Hospital passes the three tests of a winning strategy. First, it has a strong fit with Sri Lankans' healthcare needs, especially the growing demand of advanced surgery. Second, it has a genuine competitive advantage built on technology, specialized expertise, and a trusted brand. Third, it shows solid performance both financially and operationally. In short, Asir Surgical is not just another hospital. It is a specialized institution with a clear identity, a strong market position, and a strategy that is clearly built for long term success. Thank you for listening.